Well, good afternoon and good morning to those of you that are joining us. We're really pleased to have you all here with us and so glad to be able to have this conversation that we're having today with some great panelists. I'm Stacy Stewart, I'm President and CEO of the March Dimes, and we're really, again, looking forward to a great conversation as part of our whole series of Healthy Moms, Strong Babies during the COVID-19 pandemic series that we've been doing. And I just want to say that we are so pleased to have gotten the support of Merck for Moms to be able to present these webinars and present this content to so many of you all. So thanks for joining, and it's great to see you all. As usual, this is Facebook Live, so feel free to use this moment as we're talking and presenting and you're hearing from different panelists, to make sure you type your questions into the chat box, because we'll be able to take those questions and answer those questions even live for you. So don't hesitate to ask questions as you need and as you're hearing things and things come up. So just want to make sure you know that. Today, what we're talking about is something that's really on the minds of a lot of expectant mothers who really are under a great deal of stress. And some of the panelists and I were just talking a little bit before we got started about how we are starting to see a shift in the country of where the greatest pressures are coming with respect to COVID-19. So many more of the southern states are being affected. Several weeks ago when we started this, it was really the Northeast and parts of the Northwest that were really more affected. So we know that just about every part of the country, I don't know that there's a part of the country that's not somehow impacted in some way with this pandemic. And our thoughts and prayers are going out to all the folks that are in the hot spots right now. But also we're thinking about all those pregnant mothers and expectant moms who are out there who are worried about what this means to be pregnant, what it means to give birth, and are really wondering and are afraid right now about what it means to go into a hospital right now, and should they be considering other alternatives to where they deliver their babies. And that's what we really want to help you understand. For those of you that are in that situation, we want to make sure you have enough information to make good, informed decisions so that you are doing the right thing for yourself and for your baby as well. This whole idea of the pandemic has really changed so much about how so many women are looking at pregnancy and childbirth. Hospitals have changed their policies about how many folks can come into labor and delivery with the mom when she's delivering. There were changes that were made that were pretty dire and pretty extreme, and some hospitals have had to adjust that, and some have sort of backed away from that, or creating more leniency in their policies. There have been changes to doctor's office hours and limited appointment options, and so women are struggling to make sure they can keep up with their prenatal visits. And then, of course, postpartum has been really a challenge too, to think about what it looks like to do postpartum follow-up. We've also got to do baby wellness visits. So there are so many different issues that many women are facing. We want to actually get into a lot of that in terms of especially looking again at this issue of delivery and what are the situations and what are the issues that women need to be thinking about. There was a recent New York Times article that said it's not that they don't want to be in hospitals, they being women, it's that they don't want to be around COVID-19. And I think that is understandable. I think just the even thought of going into a hospital for a lot of people is just a stressful and very scary thing, because a lot of people assume that the hospitals are where the problems are the greatest for obvious reasons. And so again, if women are having to deliver at hospitals, or if they have a choice to deliver somewhere else, they understand how to go about making those choices, and that you all have the information to make those choices. There are a lot of other things that women are considering in terms of changing their birth plans. What if a woman has to have a C-section? Obviously that means she'll have to be in a hospital. Are there other risk factors that may make it so that she does need to think about a hospital versus another location to deliver in? So again, we'll get into all of this during this session. I want to introduce our great panelists who are here, who are talking about their expertise around some of these questions. And then we also have a family that just recently delivered in the midst of the pandemic. So you'll actually get to hear firsthand of what that was like and what their experience was like. So let me just start with introducing you to some of our expert panelists. I'll start with Dr. Michelle Roberts-Borden. And I may slip in, not call her Dr. Michelle Roberts-Borden and just call her Michelle. Michelle, I hope you won't mind that. But Michelle is the medical director of the National Birth Center at Inova Loudoun Hospital. That's here in Northern Virginia. The March of Dimes is based here in Northern Virginia, so she's close by and our neighbor. She's the only Joint Commission perinatal certified hospital affiliated, I guess the birth center is, the only hospital affiliated birth center that is Joint Commission perinatal certified in the country. She is also a fellow of the American College of Obstetrics and Gynecology and a practicing physician with Loudoun OBGYN and midwives. So Dr. Michelle Roberts-Borden, thanks for joining us. Sasha James Contarelli is a doctorate prepared nurse practitioner and a certified nurse midwife. She's a fellow of the American College of Nurse Midwives. She's also the current president of the New York State Association of Licensed Midwives. She's a friend of the March of Dimes and is on our New York State Maternal and Child Advisory Board, Health Advisory Board. She's also the co-chair of Governor Cuomo's Maternal Mortality and Racial Disparities Task Force. Boy, I could go on and on, Sasha. And you are also a member of the New York State Maternal Mortality Steering Committee and a New York State Maternal Mortality member of that Maternal Mortality Review Board. So thank you, Sasha, for joining as well.
Thank you.
Next is Katrina Nardini. Katrina is a certified nurse midwife and also a women's health nurse practitioner with a master's in public health. She is the associate chief of the midwifery division at the University of New Mexico and a consultant to the New Mexico Department of Health's Division of Maternal Health. She, in this role, works with midwifery licensing and regulations. In addition, she's also an executive member and the lead abstractor for the New Mexico Maternal Mortality Review Committee. And she's a fellow of the American College of Nurse Midwives. So Katrina, thank you so much for joining from all the way in New Mexico. We appreciate it. And then our family that's joining us today. And we are so, this is a first for us. We've never actually had a baby on one of our webinars. So I'm like super excited about this. And I hope she'll participate actively in this conversation and tell us what her experience was being born in the midst of a pandemic. But fortunately, we're so blessed to have her parents with her. We have Kitty, who was just born on April 22nd, just a few months ago. But her parents are Courtney Cross and Justin Lopazinski, and they are the proud parents of Kitty. And they're going to talk to us a little bit about what their experience was in delivering in a hospital during COVID-19 with the help of a doula who happens to be a staff member of the March of Dimes as well. So Justin and Courtney and Kitty, thank you all for joining. So grateful to have you all. So we're going to start, Michelle, with you. You're a practicing OBGYN. Give us a little bit of insight about what is going on in hospitals today. And again, you're going to, I know, talk about how hospitals are very different and depends on where you are and all of that. But generally speaking, give us a sense of what hospitals are doing to keep families safe during labor and delivery right now.
Okay. I think a key thing is to know that hospitals and birth centers are taking every precaution to make sure that moms and babies are staying safe during this time. Some things that you may notice have changed is we have really stepped up the cleaning that is done within the hospital, whether it's in the common areas, in the rooms. There are definitely different precautions taken since COVID-19 has come around. All staff are asked to wear masks. Their temperatures are taken at the start of their shifts. The hospital is limiting the visitors to all areas of the hospital in general, just to minimize exposure to everyone within the hospital itself. Visitors are also asked to wear a mask, and they're given screening questions upon their arrival to make sure it's appropriate for them to enter. In particular, if a patient is diagnosed with COVID-19, they are placed and isolated away from other patients. Obviously, any staff going in and out of their room are wearing appropriate PPE, and they've all undergone instruction on how to safely remove that to prevent any contamination to other areas. As we know, birth is going to continue, whether it's during a war, a natural disaster, a pandemic, and you have to give birth somewhere. So our goal is to make sure that if we can't stop birth, that we stay prepared. And definitely in the entire hospital, birth has not stopped. Labor and delivery has been as busy as it was in December of last year, and it might get busier December this year, but the key thing is we make preparations to make sure that the baby stays safe and the moms are safe, and so are their families. And the key thing is they need to be supported and feel that they are safe.
So hospitals really are trying to do the best job possible to keep everybody safe. And,
Yes.
I know there have been a lot of reports about the availability and the use of PPE has really kept a lot of essential workers, including healthcare workers, even safer. So we know that there's a high degree of the safety protocols that have been put in place are really helping a lot. But just want to ask one more question too, because there's been a lot of talk about, well, if I don't want to go to a hospital, I want to go to a birth center.
Correct.
And I think everyone doesn't even know what a birth center is. So can you explain the difference? What is a birth center and what's the difference between a birthing center and a hospital?
Okay. A birth center it's considered a safe alternative to a hospital. It's less clinical. There are some measures that are taken to ensure that the person is appropriate to deliver in the birth center. One is you want to make sure you have a healthy mom who has a low risk pregnancy. And the mom also wants to seek a low intervention as far as for her delivery. There's no electronic fetal monitoring in the birth center, and there's limited access to any pain medications or such things as an epidural, which you can't get at a birth center. So the mom has to be prepared and educated to make sure that's the appropriate place for her to deliver. The other thing is in a birth center, there are specific policies in place to make sure they're still receiving quality and safe care. So if an emergency arises during their delivery, you want to have a plan and quick access to acute obstetrical or neonatal care if needed. Birth centers also are considered more home-like, more family-centered. You may notice that the rooms look different. So instead of a hospital bed, you may have a queen-size bed or something that would be in your house. They often have a kitchen, a play area, or a waiting area for family. So even during the pandemic, there still are, specifically at our birth center, there's still limitations to who can come. We still can't have excess people coming to the birth center. So it would still mainly be the support person for the family, for the mom.
That makes sense. And we'll come back to you with a few more questions, but
Okay.
let me just introduce and bring Sasha into the conversation. Sasha, you're obviously midwifery is your background. In your background, tell us about what midwives are experiencing right now, and how are midwives now in greater demand? And if so, what are women sort of thinking about as they're reaching out and maybe considering delivering with a midwife?
Hi, okay, so great question. So number one, looking at a midwife, midwives practice in different areas. For the majority of midwives in the United States, about 95% of us were hospital-based, so most of us are in a hospital. There's also, getting back to Michelle's comments, there's two different types of birth centers. There's birth centers that are freestanding and birth centers that are in hospitals. So I work and I'm associated with a birth center that's within a hospital. So for that reason, because it's in a hospital, there's some access to pain medication and things like that. And we do have hospital beds. But for midwives within a hospital, what you will see is we really don't look much different than a physician or any other member of the team that will be taking care of birthing people during, at any time. We're integral to the team, and the care that you receive is the same, equal, and the same as receiving care from a physician. The approach to care, the philosophy is just a little bit different in how we approach care. So the philosophy is a little bit different, but same integral member of the birth team. So for midwives during a pandemic, during the hospital, for the hospital midwives, we have had the same, even greater demands as physician members of our team, but with home birth midwives or birth center, freestanding birth center midwives, they've had an enormous amount of demand for moms and birthing folks that don't want to enter the hospital. So those midwives have been inundated with calls and new clients seeking care in either a freestanding birth center or for a home birth.
And are midwives able to accommodate that now with this demand potentially for home births with midwives? Or how are there enough midwives available, and are they able to meet the demand that exists?
So this brought to light, the COVID-19 brought to light midwives in alternative birthing locations, as you mentioned before. And other members of the healthcare team for which you can birth with, such as midwives. So for the general public, there was this scrambling and a search for where could we go that there's this perceived not having COVID, right? Or staying away from a hospital and not getting COVID. So many folks have discovered midwifery, which we were there all along. And like I said, we're members of the healthcare team and we're there in many hospitals, and maybe they didn't even recognize we were there. So the home birth midwives, there aren't many midwives that do home births. There's about 2% of the population of midwives in the United States that attend home births. So going from 10 calls per month, or 6 to 10 calls per month, to 200 calls per day for folks that in the New York area, that the home birth midwives, that for folks seeking to have a home birth, definitely overwhelmed our home birth midwife population, so much so that there were midwives from other states that under Governor Cuomo's exemption tried to come to the New York area to assist many of the midwives in the home birth and in hospitals, as a matter of fact, to care for the clients that were requesting home births or birth center births or even more hospital births. So we don't have enough medical staff, period.
Yeah, sure. It sounds like it's pretty safe to say that there's probably far more women who've maybe been wanting to and thinking about home births than there are potentially midwives, at least in the New York area, to accommodate the demand, which is a big issue, right? And Katrina, let me just turn it to you and ask you, and I'm going to pick up on a question that has come in from Facebook, because it was actually going to kind of be one of the questions I wanted to ask you anyway. And I want to, because we probably need to get some terminology straight, right? Midwives and doulas. Explain the difference between the two, and how women even find them if they're looking for either one of them.
Yeah, it's a really good question, and there is a lot of confusion about the definitions, or the what's the difference between the two. The main difference is that doulas are mainly support people who are not doing really medical care during supporting the family. Basically, they support the family emotionally, physically, help with advocating and helping the family understand what's going on, the decisions that they can make, but they aren't medically, they aren't doing anything medically per se, whereas a midwife has a different type of training, depending on the type of midwife. That's a whole nother question or conversation. There are a variety of different types of midwife as well. You heard Sasha talk about, and of course, New York has a little bit different system as well, but each state has different types of midwives. In New Mexico, we have certified nurse midwives, and we also license midwives, which also have different pathways to how they got there, but the education is different. And generally speaking, a midwife will take care of a pregnant woman during her, and do her prenatal care, her care while she's at the hospital, be there for the delivery and the birth of the baby, and take care of her postpartum, both at the hospital and at home. And that would be the same if it was a midwife in a birth center as well. And for midwives that work out of the home, would do those things and watch and medically, I don't like the word medically manage, but that basically kind of do the prenatal care and do all the medical stuff. So that's kind of the difference, because doulas really are just there for support. And doulas can be a support person, not just during the labor process and birth, but postpartum as well. There are postpartum doulas that specialize in lactation supports. And there are doulas that, there are other doulas like loss doulas, who we have doulas that come into our hospital who take care of women who maybe they have had a stillborn or infant death. And so again, there's a variety of type of doulas, but again, they're there more for kind of that support element.
Right. So a woman could have a midwife and a doula, right?
Absolutely.
She chose.
And
So
also, as I say, and also midwives
and a doctor.
Many midwives act, and a doctor, and many midwives act as doulas, or have, are supportive in the way a doula might be, but with additional responsibilities. And a lot of midwives, myself included, actually started as a doula. So I was a doula once upon a time, and then moved into getting further education to become a midwife. But yeah, you could have a combination of care providers.
So let me just ask a question then. So let's say a woman got pregnant and before the pandemic, and she was already, let's just assume she was already working with an OBGYN and, was already anticipating maybe going into, a hospital to deliver the baby, the way most women deliver babies today. But now with COVID, she's like, oh my God, wait a minute, I don't want to go in a hospital. What do you, and she says, I want to deliver at home. I'd like to get a midwife. I mean, if it's in midstream of the pregnancy, Katrina, what do you tell women that may find themselves in that situation and they, are fearful and really do want to change their birth plan from what they originally had said?
Yeah, it's a great question. And actually, I've had the situation come up a couple times already. I have someone now who's transferring care. And I think the key things are, I always like to look at the picture of who she is and what's her medical background. And really, those women that are appropriate to have their baby out of hospital or in the community, as we like to say, really should be low-risk candidates and not have anything that would make it more appropriate for them to have their baby in the hospital. And so that's what we look at initially and say, oh, look, you've had a normal pregnancy, your ultrasounds looked good if they've had ultrasounds. And, we look at whether or not, what her risk basically is. And then I usually say, yeah, this sounds like a great idea. I always like to support women and where they would like to give birth. And I wish there was more choices, because we in New Mexico have only a couple of birth centers. We do have midwives who deliver at home, or home birth midwives. But again, it's limited. And so I always like to encourage them to be able to choose if they can. There is some inequities on who can choose an out-of-hospital birth, which is unfortunate, related to who can pay and where there are midwives where they are located. So I just want to keep that in the back and just mention that briefly. But I absolutely encourage them to reach out to a couple of different midwives and see who might interest them, and also make sure that they feel comfortable asking them questions about transferring back into the hospital as well. And luckily in New Mexico, we have a really good transfer relationship, at least at the University of New Mexico. And so that we have a lot of, when we have transfers in from home, we tend to be one of the hospitals that midwives go to because of the friendly relationships.
And can you go to the American College of Nurse Midwives site to find how you can maybe contact a local midwife? Is that the best way to find a local midwife if you're looking for one?
Yes and no. So the American College of Nurse Midwives will list only members of the American College of Nurse Midwife. And so I do want to acknowledge that not all midwives in the US are members of the American College of Nurse Midwife, but that's one place to go. Many states also, you can go to state websites. So for example, the New Mexico Department of Health has a roster of all the midwives that are licensed in the state. And there are other organizations there are other organizations, professional organizations within states that often have lists. I don't know if Sasha might have comments about that as well.
So the other way to find out about your midwife is to go to your insurance company and find out who are your providers for obstetrics and gynecological care. I do want to add that something Katrina mentioned about midwives is that we also are primary care providers and do GYN care. So it's not just concentrated around having a baby, because that's only a finite period of time that a person is of reproductive age. So we truly do, and the model for American College of Nurse Midwives is caring for people from birth to death. So it was women, but understanding that there are folks that do not identify as women, but do have female reproductive organs. So folks that do identify as reproductive from birth to death, because we do newborn care as well.
Terrific. Justin and Courtney and Kitty. I wanna bring you. Oh, good for her. Well, this is the best baby. Every time we see her, she's taking a nice little nap.
Thank you, and thank you
for
for having
her.
us on today.
Yeah. Well, thank you all for joining. Hey, can you guys just talk a little bit about your experience? I mean, you used a doula and you chose to use a doula. Talk about what your planning looked like and when you found out you were pregnant, you're finding out we're in a pandemic, you went to a doula. Talk a little bit about what was going through you all's heads as you were sort of planning for Kitty's arrival through this pandemic.
Sure. So we came into the pregnancy and the delivery from a place of privilege where we were able to have great health insurance and be able to choose an OBGYN practice that collaborates with certified nurse midwives. We were able to use a doula. We were able to choose a non-local hospital to deliver at. So we had a lot of tools in our toolkit going for us. And it was still so unbelievably chaotic.
Yeah.
As COVID was unfolding, because we didn't know, would Justin be able to be there with me? Would the doula be able to be there? We had not met our fantastic doula face to face until the day of the hospital trip, because everything was over FaceTime. So there was a ton of uncertainty about what sort of the tail end of the pregnancy would look like, what the delivery would look like. And it was sort of complicated by the fact that we had planned on a sort of no to low intervention birth, and in week 38 discovered that Kitty had flipped breech, and so our birth plan was thrown out the window 1,000 times over. But the way that COVID sort of impacted that was just how hard the OB and the midwife worked to make sure that I wouldn't have to have a C-section. We live in Alabama, and the birth happened when we thought Alabama's COVID cases were peaking. We were wrong about that, and that seems to be now, but everybody was very worried and wanted to avoid, an unnecessary surgery and a longer hospital time, and the fact that we would then be coming home to no family who could help us through that harder recovery. So COVID very much dictated how the labor ended up going. It ended up being sort of a 36-hour ordeal that began with Kitty being flipped manually. And a lot of that was done sort of in light of trying to do everything we could do to minimize our exposure to COVID and the complications that might sort of bring in for us.
Yeah. Yeah, it was, in the lead up to, I'm a social worker, and in the lead up to it, I had a COVID scare at one of my sites, and in something like week 30, yeah, I had to self-isolate for 2 weeks, right when I think Courtney needed me most, and it was a very storied experience that I'm sure Kitty will appreciate.
Yes.
Much more a few years from now, but right now we're just thrilled to have her here and in one piece.
Yes, and everybody did a great job. At the hospital that we went to at the time, everybody had to wear masks all the time. I was really struggling with breathing and nearly fainted at one point, so I was allowed to take my mask off, but Justin, the doula, and all of the medical professionals wore theirs the entire time. Our first family photo is Kitty, Justin, and I, and Justin still has his mask on. So we definitely have the receipts that this was not sort of the typical labor and delivery.
Yeah, but wow, that was very stressful. Yeah, no wonder Kitty's asleep. She went through quite a lot to get here. But you knew that you wanted to use a doula from the very beginning, so you had already built that in. Yeah.
Yes.
And by the time you got to delivery, Justin, you were able to be there. The doula was able to be there. And that's good.
Yeah, and especially because we weren't able to have family in there with us.
Yes, the hospital said absolutely no visitors.
And we weren't sure if I'd even be able to be there. The fact that we had somebody there who was with us just about every minute that we were in the labor and delivery room. It helped tremendously. I don't know if we could have done it without Britta, our doula, who really not just provided material and practical support, but was our best friend when we really needed one.
And she did an amazing job staying on top of hospital policy and protocol. I was sort of glued to the hospital's Twitter and wasn't getting a ton of information that way. And she was able to sort of get more info about how the landscape was shifting on an hourly basis. So we knew what we were going into.
Yeah. So that was the important role that a doula played there, is that like help be with you, to help calm you and coach you and support you, which was great.
Yes, and she did such a good job sort of making sure we were ready to be flexible, because you think you've got your ideal birth plan, and between COVID and kitty flipping breech, having somebody who could just remind us, we're getting this baby out one way or another, but we just can't stay married to how we thought this might look, was
Right.
so helpful. And she was working with us on that, a week before the labor.
So that's a really good point. Just kind of staying, as resilient and as you can through these trying times. So I want to ask a question. This actually came from Facebook, and it actually occurred to me. So thank you for the question, whoever asked it, which is, it does sound, and Justin, Courtney, thank you for saying it, that you were coming from a position of privilege. You could afford to pay for these things. But we also know that, over 40% of all births are covered by Medicaid. And so we've got a lot of women who may not have access to a lot of these resources. I don't know, Michelle, if you want to start there, or whoever wants to chime in, talk about what's available in terms of coverage, or just generally. I don't want you to be like an insurance expert or anything like that, but what things are covered? Are doulas covered? Are midwives covered? I mean, obviously when you go into labor delivery, if you've got insurance, but especially with Medicaid, what does this mean for Medicaid moms, especially, and those that may not have access to private insurance?
Medicaid moms do still have options. I mean, our practice itself also takes Medicaid patients. So physicians, midwives, they can accept Medicaid. Medicaid will not often pay for a home birth. I'm not sure of any insurance that pays for a birth at home. So we do realize that there are alternatives. The birth center also will take Medicaid patients as well. So they do have options in that respect. They just would have to check and see. Oftentimes you have to call and ask specifically. So they should be able to access a physician or a midwife. Now doulas, I'm pretty sure that they're, for the most part, out of pocket. If I'm wrong, somebody correct me, but I don't know any that are taking any insurance. But there are some like doula programs where there are doulas in training, and they do provide access to women who can't afford to pay a doula who's already out in business.
Sasha, in New York. Oh, go ahead. Sorry.
Oh, I was going to say, I'll add to that and just say, actually in New Mexico, we have a birthing options plan, which does cover women who have Medicaid to have a birth out of hospital in the home birth setting. So it does exist. They are paid on some type of scale that's not quite equal to other private paying clients, but it does exist, which is a really nice option for women in New Mexico at least, but that doesn't exist in most states. So you're correct in that statement, Michelle. And then the other thing I just wanted to add about doulas is some hospitals and programs, my hospital included, have doula programs where doulas are available and on a volunteer basis. They've actually just started doing, making them available virtually for women who test positive for COVID. And so that would be the other one, is to look and see what hospitals in your area might offer a volunteer doula program that would offer services. Some of them don't necessarily have 24/7 coverage. Unlike Courtney and Justin, you may have a doula switch out, right? So you might have different doula, but having that support often for some people is really important. And especially during this time of COVID, where I've had people say, oh, like, we don't have any help at home. My partner's going to stay there with the children. I'm going to go in by myself because, we don't have any other options. It can be really nice to have that as an option and to be available.
That's great. And Sasha, I was just going to ask you too, I know in New York, there's been a pilot of reimbursement under Medicaid for doulas. I don't know how that's going. And I know there are a couple other places around the country that have been experimenting with that. I don't know if you can comment on that, or I want to add to that conversation about doulas and Medicaid reimbursement.
So yes, we have a doula pilot program in New York where doulas are being reimbursed through Medicaid, and there was a pathway that was established. But the limitation is it's only in a certain zip code in Brooklyn, as well as a certain zip code in Buffalo, New York. So there's 2 different zip codes to see if they would be successful if we could continue the program. Now, what I would add is the inequities of having a doula is, and I'm glad that Justin and Courtney brought it up, it is from a point of privilege. Not many folks or most folks know what a doula is, as just as a question, entail what's the difference between a midwife and a doula. Some folks believe that if they're going to a midwife, they're getting a doula, and so they don't understand, or vice versa, if they're going to a doula, they're getting a midwife. And so for the majority of doulas, for them to even stay in business and have this as their sole profession, many of them do not take insurance, and it's private and out of pocket. And because of the time and the energy that they're investing into each couple and family that they're attending to.
Yes. Well, one of the things that at the March of Dimes from a federal advocacy standpoint is we've been encouraging Congress to think to expand coverage, Medicaid coverage, to cover doulas, because there is a lot of evidence that shows that doula care can be quite helpful, improve maternal health outcomes and birth health outcomes. And it gives women more options, right, in terms of the support that they think they need, and especially for women of color. And, you know, we feel very strongly that because you're of lower income, may not have access to private insurance or other resources, that shouldn't be a reason to limit your options if you choose and want to have access to that kind of care, the way Justin and Courtney were able to access it. So that's really great. I want to just talk a little.
I would just add that, in my opinion, and in many midwives' opinion, it would be great for each woman to have a OBGYN physician, a midwife, and a doula as their support team to truly holistically care for a birthing person, because you have all the different philosophies and support there.
That's what we had, and it was amazing. You know, we had sort of joked that there were going to be way too many people in the room. And when the rubber met the road, we couldn't have done it without every single person who was there. It was so amazing to have that many perspectives and that much support. It was an incredible team that we were so lucky to have help us bring Kitty into the world.
Yeah, birth, I mean, it can be just so chaotic and unpredictable in the best of times. And then COVID threw us this massive curveball, and we were happy to have all the help we could get.
So in the midst of a pandemic, it's probably we've been talking about limiting the number of people. Maybe it's expand the number of people, just make sure everybody's got masks on and it's been tested. And of course that's all happening. I think what's really clear though, is that in all of these settings, the healthcare workers, whether they're the doctors, the midwives, and the doulas, everyone's super sensitive to wanting to stay safe, keeping the mom and the baby safe, everybody staying safe themselves. And maybe that's ought to be the message, so that women can sort of de-stress a little bit, so that they don't get overly concerned, and that they sort of can thoughtfully plan their birth with the right team of people. Sasha, great point, that can help support them, right? I think that's really important. Katrina, I wanted to ask you too, because in New Mexico, you're dealing with, very diverse population of people. I mean, all of you all are, but you've got a Native American population. We've been hearing about the impact. Obviously, we've been focusing a lot on the disproportionate impact of coronavirus on communities of color generally. I've been really struck by what's going on in tribal lands. Obviously, you're dealing with Hispanic population. Talk to us about what you're seeing among those populations, and how are they having to adjust some of their birthing plans, and are there things that are unique to those communities that you've been seeing?
Yeah, thank you for that question. Navajo Nation, which is in part of it is in New Mexico, has been struck quite hard by the COVID virus, and because of that, we've seen a huge impact on a lot of the other tribes in our state. We do have 23 tribes, federally recognized tribes in our state, which is a large proportion, 11% of women or people in New Mexico are identify as Native American, so it's a large proportion. And what we've seen is that a lot of the tribes, a lot of the pueblos have closed, kind of locked down their pueblos, not because, or closed their doors to having anyone come in or out. And that's not because they have high rates of infection other than Navajo Nation, but more that they're worried about the virus coming in and wiping out some tribes that are actually quite small. Some of the tribes are as small as 300. A lot of them are in the thousands, 2,000, 3,000 numbers. And again, Navajo Nation is much, much larger, but because of that fear of it coming in and wiping out huge numbers of their population, what that's caused is we had for a while, many of the pregnant women that lived on those pueblos, again, they have an IHS or an Indian Health Service, often medical facility. Those weren't always open. Those weren't always seeing pregnant women. So most of those women have to travel to metro areas for care, often quite a long distance as well. And so some of them weren't allowed to leave their tribal land or the pueblos because of the lockdown. And so we got really good fast, as I'm sure Michelle and Sasha can attest to, at doing phone visits and virtual visits, and really trying to accommodate and be able to still take care of them in as the best manner that we could from a distance. And of course, in Navajo Nation, there's just so many inequities, which is part of, I think, why they were hit so hard, because the level of poverty is huge. Many houses do have no water, electricity. They have one car. Often families travel very long distances, sometimes hours, to get to just to store to buy food because of the food deserts, or to get healthcare services. And so it's been a really big impact in our state, and we're, I think, trying to look at ways that we can just provide the best care possible. There are some groups and services. There is a midwife who is providing a care to Native American populations. She's Native American herself. She has does home birth care as well, and we've just been trying to funnel a lot of resources to those areas as much as we can.
It's a really tragic situation. So thank you we want to shine a light on that, because I think it's important for everyone to remember that there's some really needy communities. I want to go back to this question of Michelle on, okay, so now again, what are some of the questions that a woman should really be asking herself to make these decisions on? Should I stick with the hospital? Should I consider a birth center? Should I consider a midwife? I mean, should I consider a home birth? What are some of the questions women need to be really asking themselves, or maybe asking a provider to help them make informed decisions on where they ultimately want to try to deliver their baby?
I think first and foremost, they need to look at, what's the safest option for me? Even without the pandemic, most births do happen within either a hospital or a birth center setting. Am I appropriate to deliver even in a birth center? What are the risks to my specific pregnancy? What risk do I bring as a patient? We do want to make sure that everything is in place to give you the best outcome possible. So you don't want to automatically say, oh, it's a pandemic, I can't go to the hospital. What changes are we making to ensure that you're safe at the hospital or in a birth center? And is it appropriate, if you are to choose an out-of-hospital birth, are you an appropriate candidate for that? Do you have plans in place in the event an emergency does occur? Because we do know that birth is unpredictable, and if an emergency arises, you need to have a plan in place for rapid transfer of care if it's needed. We do know that in the hospital, everyone is being tested who comes in for admission. So that does allow us to put someone who may be COVID-19 positive away from other patients as well. So there are definitely plans that we've made to help make the patients make a good decision as far as for their birth.
Sasha or Katrina, any other questions that you'd advise women to be sure they ask?
I would definitely tell each birthing family to have a conversation with their provider. If they are planning, whether or not they're planning to birth in a hospital, have a home birth or a birth center, to ask the questions about safety and precautions that are being taken in the light of COVID-19 to ensure that they have a safe birth, and to have their questions asked by their provider. So where do you attend births? What are the differences? What does it look like now versus before COVID-19? Who will be allowed to attend the birth with me? Will I be allowed to have support people? Will be my doula, if I do have a doula, be allowed to attend the birth with me along with my support person? Are there differences? Is everyone being tested? Will I be tested? What will happen after the birth? So what does it look like? Is there a difference in the length of stay? Will my partner be able to stay with me? And will my baby, if I'm COVID positive, will my child be separated from me? Am I allowed to breastfeed if that's something you desire? Those are the sorts of questions regarding labor and birth that most families, even without COVID, want to know. But now in light of COVID, it's a conversation with your provider, because you need to understand if you are choosing to, and Michelle and Katrina talked about this, if you're choosing to midway during your pregnancy switch providers or go to a home birth, you need to have the conversation. Are you appropriate to even do that? Am I an appropriate candidate? And if I do so choose, what's your association with transfer of care? For me, for my baby, will I be allowed to go with my baby if something does occur, right? So many midwives tend to, because I said 95% of us do work in hospitals, the transfer of care policy is already set up. But if you're in a freestanding birth center, are they affiliated with a major medical center or another healthcare system? And if you're a home birth midwife, because many home birth midwives do have contracts and do have transfer agreements with hospitals. So they're not just out there by themselves. So that's why it's really important for birthing families to have those conversations.
You know, there's a question from Facebook about, is having a child even a good idea during COVID-19? You know, Justin and Courtney, if you had to do, I mean, obviously you were pregnant before the pandemic really hit. If you had to do it, if you had not made the choice and had not already gotten pregnant before the pandemic, what would be your thought process if we were right now and you all were still thinking about being pregnant? Would you choose to try to go forward with pregnancy? Would you delay it? How would you think about it? And then I'd love to hear what the other providers have to say too.
You know, I think if we knew that we would have sort of the team that we had, we would feel encouraged by it. I don't know, it's a complicated question that's hard to speculate about, but what I will say is that during all of this chaos, Kitty has been such a source of joy for us that I think that we may actually be sort of holding up better than a lot of folks, you know, despite the anxiety and the craziness, because we do have this wonderful baby. So even though, you know, it adds sort of a shadow over the labor and the delivery, it has been so great to be here with her that we can't imagine not having her. You know, if at this point we were thinking through all this, you know, I think the fact that, you know, we're in Alabama and, you know, everything is sort of so uncertain right now would weigh heavily on us, but we're so glad that we did make the choice and that we do have her now.
Yeah.
That I really do think she's helping us navigate sort of the craziness of COVID.
Absolutely, yeah. She's a nice refuge when you know, everything seems to be falling down around you. You at least have, you know, a nice.
She is a nice refuge. She makes me happy just looking at her.
Yes.
It's a nice pickup in my day. Michelle, what are you telling your patients if they're not pregnant yet, but they want to be pregnant and it's right in the middle of the pandemic? How are you advising your patients?
One, that they need to have an individualized approach. What's going on with your family, your work situation? If You know, would you be planning on it even if there was not a pandemic? And we know that information is evolving, things are changing, but as it does change, we make adjustments accordingly in order to care for you in the best way. So it's hard for me to tell someone, no, don't get pregnant, because one, we don't know how long this is going to last. And for some people, they don't have the opportunity to wait a year or 2 years because time is of the essence. So we just say, if it's going to happen, just be prepared to be flexible, because as things change, what your birth will look like and what things will look like will change as well.
I want to add that we have to recognize that for many of us, birth is not even planned.
Right.
It's not, that's a privilege to have, to say, I want to get pregnant now, I'm going to get off my family planning now, and we're going to have a baby within this amount of time, and it magically happens for that person within that time. That's not the common story. Most of the time, the story is, we're together and I'm pregnant. And we're gonna roll with this. And
I'm pregnant.
Or I'm pregnant. And you know, and I do want to keep my child. So then you have the questions. But Michelle's absolutely right. It's an individualized approach. I don't think any provider would say you should not get pregnant during COVID-19, because we don't have enough information to say that. And we don't know everyone's lives, right? But it is having that holistic view of, what does your life look like? And what are your goals? And would you like to have a baby now? And we'll be as safe as possible, and we'll get you through it together. Again, if it's a team approach, and we're keeping our families informed, and we're having them have a shared decision making, there's no reason for us to say yay or nay in one way. It shouldn't be black or white. It should be a very individualized, team, educated, shared decision-making model.
Yes, definitely.
Very good, very good.
In some ways it shouldn't, as I say, in some ways it shouldn't be any different conversation than if COVID wasn't around, right? We like to think that
absolutely
have that conversation about timing and planning and appropriate birth control, regardless of where we are or what's going on in the world. Obviously, it does add to it, right? People do think, oh, wait a minute, maybe they double think before getting pregnant. But I just wanted to add that.
Absolutely, Katrina.
It's a great point. It's a great point. And certainly women having the choice to plan it. And then there are other health considerations that women have to consider, right, too. I mean, from a health perspective, we all at the March Times, we want to make sure that women are as healthy as they possibly can be. You know, that they are managing any chronic health conditions they may have, that they are, you know, eating good nutritious foods as much as possible, that they're exercising as much as possible. And, you know, if it feels like, you know, there's undue stress in a woman's life, you know, maybe she might want to wait a little bit until maybe the situation gets settled down, if her partner's lost a job. I mean, there's just so many, you know, it's completely understandable right now if a woman would want to choose to delay it. But of course, Sasha, your point is well taken. You know, half of all births are unplanned or unexpected at the time that, you know, women actually get pregnant and give birth. So we have to be prepared for all situations and have to have a system that supports women in all of those situations as well. So, well, this is great. And I really appreciate you all. And I really, really appreciate the expert advice that you all provided. You guys have taken some precious time out of your day to be a part of this. I want to especially thank Justin and Courtney and Kitty for being with us and sharing their experience, and really appreciate all of you all being with us today. As we close out today, I want to just again thank you all, but also want to thank Merck for Mothers for sponsoring and providing the support for the March of Dimes to bring this kind of content to everyone. We're going to show on another slide just some additional links and resources. So if anyone wants to follow up with more information, you want to know where to go, here's some pages at the March of Dimes page, a COVID-19 page, just information about COVID-19. We have information on how to prepare a birth plan. So this is all about, you know, how do you prepare for your birth and how do you think through all of these different considerations that you might want to take into account if you're pregnant now and thinking through till childbirth. Also, the CDC has great information, which we always love to share. And the last thing I just want to say is that, you know, I think what we've learned today is that there are a variety of different options that women may have available to them, that it does take investigating, talking to your providers, asking good questions, making sure you're well informed, doing your research, and making a decision that you think is right for you. But also building as much support system around you. It sounds like it's a really important and good thing to do. And we certainly want to encourage all of the systems of care to be mindful of what pregnant women and families are going through during this very challenging time. We're really appreciative of all the health workers who are doing such an amazing job to keep themselves safe and keep us safe as well. I want to certainly encourage everyone, if you love this kind of content and want to see more of this, please consider giving to the March of Dimes for us to do the important work that we're doing. If you want to text to give, you can text MOD give to 51555. That allows you to support us and allow us to continue doing this really important work during these very tough times. Lastly, I just want to say is please join us. July 9th, we're taking off for the week of next week, which is the July 4th, around the July 4th holiday, but we'll be back for another webinar on July 9th. And we're continuing the conversation on July 9th about these issues of systemic racism and how that's impacting moms and babies today, especially moms and babies of color. So that one will be really exciting. It's part 2 of an ongoing dialogue we've been having, and we're looking forward to talking about all kinds of questions and issues as it relates, especially to moms and babies of color, but especially to the African American community in particular. So please join us for that, and just look for this. And if you want to share this webinar on your own Facebook page, go to them. This will be on the March Dimes Facebook page. You can look at it. You can share it with your friends, and make sure that as many people that you know need this information that we shared today have access to it. And thank you for joining us, and look forward to seeing you in a couple weeks. And thanks to all the panelists and to our family as well. Thanks, guys.
Thank you.
Thank you.
Thank you.
Thanks.